My name is Deborah Carter. I'm the head athletic trainer for Grand Canyon University's Club Sports Department. It is my pleasure to introduce Bella Sheed. Bella was a student of ours for the entire school year last year, where I got to see her grow and develop as an athletic training student. I'm excited to announce that she will be attending the University of Iowa as a graduate assistant athletic trainer for their track and field team. Bella's Capstone project is impacts and implications of pregnancy in elite female athletes. I was excited to be her mentor for this project as I am due at the end of the month with my first child. So this was a really cool research study that she did, and I feel very honored that she chose me to be her mentor. So without further ado, here's Bella.
Hi guys, my name is Bella. I want to thank Deb for that amazing video. She's up there, so that means she's not due for another few days. I chose to do my topic on impacts and implications of pregnancy in elite female athletes. So the topic we're going to go over today is my people, problem, and purpose statement, some methods I use to find my research, my 5 themes, evaluation of literature, and some areas of future study and questions at the end. My PICO question is, in professional sports, how does the lack of education in pregnancy for female athletes affect them both physically and psychologically? My problem statement, the main problem is insufficient education and research in pregnancy for elite female athletes. Some of the evidence-based research that is lacking is safety concerns and proper training, portrayal of elite pregnant athletes, support for pregnant athletes, pregnancy planning and disclosure, and the effects of exercise. My purpose statement is to locate, analyze, and summarize the gap of knowledge and regarding pregnancy in elite athletes, finding evidence and knowledge regarding elite athletes and their healthcare providers, and addressing key issues to provide valuable insight on recommendations to support them. So I chose to do this topic kind of out of pure curiosity. I didn't have any specific background as to why I chose it. I started digging into it and found some of the stories, like Serena Williams' story. Her story fascinated me. So I was curious to know more, and I feel like it's a topic that's not well talked about in our profession, and it needs to be talked about. Some of my methods I used, Boolean search method. I used Google Scholar and Grand Canyon University Library Database. The cutoff dates I had was 2012, and they had to be peer-reviewed in English and contain 1 or more of the search terms. I had a total of 20 articles to end with. So my first theme is discrimination and admiration. So these are 2 ways that athletes are typically viewed in the media or in the world in general. How many of you know Serena Williams or heard her story? So on the discrimination side, their athletes are seen as giving up their careers to become a mother. There's the contracts are pulled once they have disclosed that they are pregnant, and there's a salary decrease typically. You'll see that in Allison Felix's story, and a lot of media portrays athletes as they're being unsafe when it comes to training, and that was seen in Serena Williams' story. She competed in the Australian Open when she was pregnant, and she was very much so discriminated for that. And with all of that discrimination, it leads to mental health issues, which is increased anxiety or increased depression. On the other hand, you have your admiration. So a lot of athletes are empowered and pushing their bodies to the limits. They're admired for their hard work, their discipline, and their dedication to their sport. And they are paving the way for future athletes. One example of this is Daria Torres. She is a 12-time Olympic athlete. She is a very decorated athlete who's an Olympic swimmer, and she had a baby, and 2 months after, she competed at the Master World Championships just after giving birth. So she was very much so applauded for that. These are just some media examples that I found that showed how the media portrays different athletes. A lot of these are negative examples. And then this is a video that I have a little intro into Allison Felix's story. If it doesn't work, I'll just explain. track and field. She is one of the most decorated athletes, having a bunch of medals from the Olympics. She had a contract with Nike at the time when she found out she was pregnant. They decided to pay her 70% less while renegotiating her contract. She had 2 teammates who were also in the same situation. Allison later decided to cut ties with Nike and started her own brand called Stache, which is a shoe brand dedicated for women. She's one example of an athlete who was very much so discriminated in the sense of her contract with Nike, but she has also been a huge influence in the world of mothering and elite athletes because she's paved the way for many other future mothers by speaking out about her situation. So as for the next theme, okay, so support for pregnant athletes. So this kind of goes with Allison Felix's story. The United States Olympic and Paralympic Committee has a EAHI, which is an elite athlete health insurance. That insurance states that if female athletes become pregnant, they can continue to receive the same level of care that they were receiving before they were pregnant, during the pregnancy, and after the pregnancy. They are not obligated to continue to train or compete for a year after pregnancy. So this policy is a good policy, but it is very unclear and not very specific. They don't go into specific sports. Obviously, we know there's a lot of sports in the Olympics, so it doesn't go into sport or anything like that. So that makes it kind of an unclear policy or contract. Again, another unclear contract was the Nike contract with Serena Williams. They didn't know what to do when she said she was pregnant, so that was one thing that needs to be changed. So it needs to be more specific and we need more policies. On the other hand, you have support. Foundational support systems and support groups are huge for female elite athletes. This helps on the mental health side of things, having that support. You know, they say it takes a village to raise a kid, so having that support is beneficial. And then on top of that, knowledgeable healthcare providers are hugely beneficial. Pregnancy planning and disclosure. So disclosing pregnancy, a lot of athletes are reluctant to tell their coaches or their teammates or their doctors. They're afraid of losing a spot on the team, and they are afraid that their dedication to their sport is going to be questioned in the end. There's a lot of conflict with anti-doping regulations. So if an athlete decides to go through fertility treatments, they have to inform their sports organization and their healthcare provider due to the conflict with the anti-doping regulations. Last, athletic trainers. We are typically, I found in one of the sources that we are typically one of the first healthcare providers to know, due to always being constantly around the athlete and at that level of sport. So the 4-year Olympic cycle, a lot of you know that the Olympics happens every 4 years. They have to be very strategic when planning a pregnancy. They say that the best option would be the first year of the cycle. There's limited time to attempt and succeed, and for those athletes who have fertility issues and want to go through IVF, this is something that takes about 6 weeks, and typically, on occasion, the first cycle of IVF is not always successful, so then that adds another 6 weeks more time added on. Some safety concerns. So I found that cardiovascular exercises such as walking, swimming, yoga, jogging, and stationary cycling are all best for all 3 trimesters of pregnancy. Fetus health is generally unaffected if doing moderate to light weight training using free weights or weight machines. And some warning signs and symptoms to look out for are some recurrent painful contractions, some uncommon bleeding, some dizziness, headaches, calf pain, or chest pain. One of the big key things that I came across almost every single one of my articles was pregnant athletes, elite athletes specifically, should train to maintain instead of training to build strength and stamina. Safety concerns continued. Specific activities during pregnancy. It's advised against that athletes don't do HIIT training, heavy weight training, and contact sports with an elevated risk of microtrauma. Gradually reducing training load during the 3rd trimester should also be considered. Some physiological changes that happen during pregnancy. This is not just for elite athletes, this is for all women in general. So organs are pushed superiorly due to the fetus growth. There is respiratory changes, which include an increased oxygen intake and an increase in pressure on lungs. Cardiovascular changes include cardiac output, increased blood volume, increased heart rate, and increased stroke volume. Hormonal changes is increased relaxin, progesterone, and estrogen. And then postural changes as well. Obviously, if you're growing a human inside of you, you're going to have postural changes with your spine, pelvis, and shoulders. These are all factors that need to be considered when going through and prescribing exercise or training schedules. Last, effects of exercise on the mother and fetus. So there's positive and negative effects found. Majority were positive. There's decreased rates of C-section deliveries, gestational diabetes, hypertensive disorders, maternal weight gain, and postnatal depression. Some advantages for the baby that I found once they were born was improved body weight at birth, improved cardiovascular health, and improved nervous system development. Some negative effects that I found were increased risk of placenta hypoxia, fetal bradycardia, low birth weight, premature birth, and risk of miscarriage. That was only seen in one article that I found, which was the VLOC article. This was the only one where they stated during performance testing, they had athletes doing 9% max heart rate, and some of the fetuses experienced a deceleration in their heart rate, which in small quantities, this is not harmful to the baby, but if repeated, it could be harmful. So my evaluation of literature, all of my themes I kind of combined. I took a couple and combined two of them that had similar information in them. The support and portrayal of elite athletes was one. It's important that athletes have the support they can, so that if they have that portrayal of discrimination, they can get through that. Safety concerns and effects of exercise were another one I found. Obviously, there are safety concerns with exercise, so it's important that these are monitored by somebody who knows what they're doing. And last is planning and support for pregnant elite athletes. This is important when it comes to like having a birth plan, having an exercise plan, and a health plan. And then last, areas of further study. These are the 4 things I think should be hit on in the future. The physical and psychological effects of pregnancy on athletic performance. There needs to be a larger and more diverse population. A lot of the studies that I saw focused specifically on either one sport or one athlete. So I feel like having a broader population would be good. The impact of pregnancy on injury risks, so the susceptibility to certain types of injuries due to those physiological changes that happen. The role of medical professionals in supporting pregnant elite athletes, physical and mental health are both important. And then the impact of pregnancy on career trajectory. So this would be a longitudinal study. That would be a long-term study starting from when they have their child and on to see how they do for their future career and if they decide to have another kid later on. So we know that there's limited knowledge on pregnancy in elite athletes, which leads to quite a bit of challenges. Our main concern is always the safety of the mother and the baby, and more research is going to be needed in the future. And thank you. I want to thank Deb for being able to make it today. I can't wait to meet your little baby. And I want to thank all of my classmates and professors.
So a lot of times, like with female athletes, especially in the elite level, when they get pregnant, they usually turn to just retiring. And I know that's been like highly publicized. Is them retiring like due to pregnancy still pretty high, or has it decreased like since more education has been coming out?
So there's been a really big gain of respect for women in elite athletes, and I think that a lot of the committees that have been put out and started, such as Allison Felix, she's been one to speak out. Elite athletes are not as scared to come out that they are pregnant, and they're not as scared to come back after pregnancy. A lot of them are there to show, such as Daria Torres. She was one who had a child and then competed 2 months later and did very, very well at that competition. So having seen that and having women pave the way beforehand has made it easier for them to do that.
The culture around pregnancy in track and field is silence. Get pregnant and you hide it. It can feel so risky when your livelihood depends on it. I'm Allison Felix, and I've won 9 Olympic track and field medals, and that makes me one of the most decorated women in track and field history. I've done a lot of promotion for Nike. They've used me in a lot of their stores and a lot of the campaigns, but I'm also a mother. I don't think I can just sit back quietly anymore.
Yeah, so that was a little intro video that was for Allison Felix, for those of you who don't know her.
So how do you think they should like go around like promoting the like pregnancy in women's sports and like people being advocates and people being able to support?
So there's actually quite a bit that's happening. Allison Felix started a campaign with the CDC called Hear Her. This is one it's not only for elite athletes. There's a lot of elite athletes who are coming out and talking about it just because of the platform that they have. But it's for all mothers in general, and it's just talking about how exercising is beneficial during pregnancy. And it also talks about how some of the issues that come along with birth and the complications that can happen during birth. So that was one thing that has been hugely beneficial when it comes to getting the word out there about it. And Allison Felix also helped Nike change their contract. So their contract states that they officially, I wrote this down because I was making it was they can guarantee a pay and bonus for 18 months post birth. So even if they are not working with Nike directly on doing campaigns or ads, they're still gonna have that back to fall back on. Yes.
Don't be nervous. I'm actually not going to ask a question. I just want to say that before I go to a meeting, that you really made me think about where we talk about this in our programs, because I feel like there's a push for like DEI stuff, and there's a lot of things that we think about when it comes to that, but really made me think critically about what we can do to better instruct this in the program. I thought it was a very well done presentation. So I mean, I was thinking about the whole time, like where can we put this? So